This video is for NURS 5120 Adult Gerontology Assessment Module 2 assignment. Here is my student ID. I also have a blank paper. I will quickly scan the room. Okay, I will start. First, I will wash my hands. My name is, I'm a nurse practitioner. How are you?
I'm good. How are you?
I'm good, thank you for asking. May I have your name and date of birth?
My name is Mike Wu. My date of birth is July 1st, 2001.
Mr. Wu, what do you prefer me to call you?
You can call me Mike.
Okay, Mike, do you consent to be videoed for this assignment?
Yes.
Do you mind we don't wear face mask?
No, I don't mind.
Okay, what can I help you today?
I had a cough for several days.
Several days. How many days do you remember?
About 3 days.
Okay, 3 days. Do you have any other symptom?
Yeah, when coughing and had some mucus too.
Do you notice the color of the mucus?
Light yellow.
Okay. Do you have any other symptom?
A little bit painful when I was coughing.
Okay. Does the cough happen in specific time during the day?
No, actually, it just happened all the day.
Does it happen worse or better in specific time of the day?
I think it's worse. I think it's worse during the midnight. I'm coughing more often.
Okay. Is there anything make your cough better?
Not really.
Is there anything make your cough worse?
No, I didn't try spicy food, but I think that will make my cough worse.
Does your cough happen consistently in the whole day, or it come and go?
I think it's consistently.
Okay. Could you rate your cough on a scale 0 to 10? 10 is the worst.
I would say 6.
Could you rate your pain on a scale 0 to 10? 10 is the worst.
Maybe 4.
Okay. That's the pain radiation.
No, just to focus on the throat.
Okay. Is there anyone around you have the same symptom?
Yes, my girlfriend has same thing about 1 week ago, but now she's recovered.
Okay. She's recovered. Do you have any international traveling recently?
No.
Okay. Okay, Mike, in order to help you, I will ask you some questions about your family history and social history. Could you tell me whether your parents are alive?
Yeah.
Do they have any health issue?
No.
How old are they?
They're about 50.
Okay. What about your grandparents? Are they alive?
No. Both of them have passed away.
I'm sorry for your loss. Did they pass away because of a specific disease?
My grandma just passed away because of the stroke.
How old when she passed away?
Around 60.
Okay. What about your grandfather?
He passed away because of an accident. So.
Okay. Do you have any siblings?
No, I'm a single child in my family.
Okay. Mike, next I will ask you some question about your social history. What's your occupation?
I'm a mechanical engineer.
Do you expose to any new substances recently?
No.
Okay. Do you feel safety during your work?
Yeah, I'm working in the office.
Okay. You said you have a girlfriend. Do you have a good relationship with her?
Yes, we are very close.
Do you live together with her?
Yes.
Do you live in a house or an apartment?
We're living in a house.
Okay. Do you smoke?
No.
Do you drink alcohol?
A little bit.
What kind of alcohol?
Beer, wine, and I'm not picky.
Okay. How often and how much do you drink?
Basically, I drink every day, and usually just 2 bottles of beer or 2 cups of wine.
Okay. Do you take any illicit drug?
No.
Okay, that's good. Did you take any medicine for your cough?
Yes, I bought some syrups to release my coffee.
What kind of syrup?
Mucinex.
Oh, Mucinex.
Uh-huh.
How often and how long did you take Mucinex?
I started to take it about 1 day ago. I read the instruction and just took it about 3 times a day.
Do you remember the dose?
Yes, the instruction told me that every time I should take 600 milligram per time.
Did you take any other medicine
No.
for your cough? No. What about the herbal medicine?
No.
Any vitamins?
Usually I take the vitamin C as the daily vitamin taking.
Vitamin C.
Vitamin C, yeah.
Oh, okay. Do you have any allergy?
A little bit of seasonal allergy.
What about medicine allergy?
No.
Food allergy?
No.
Pet allergy?
No.
Grass allergy?
No.
Okay. When is your last physical exam?
Last year September.
Was everything good?
Yeah, everything looks good except a little bit overweight.
Okay. Now I will ask some more questions about your immunization. Did you receive all the vaccine during your childhood?
Yeah, I think so.
What about the current vaccine? Did you receive the COVID-19?
Yes.
When did you receive the COVID-19 shots?
About 3 months ago, I take the second dose.
What brand did you take?
Pfizer.
Pfizer?
Mm-hmm.
Okay. Did you take your flu shots?
Yes.
When did you take your flu shots?
Last year, October.
Okay. Did you receive your Tdap vaccine?
Yes.
When did you receive your Tdap?
I think it's a long time ago. I couldn't remember the exact time.
Is that within 10 years or outside 10 years?
I think it's out of 10 years.
Then you might need the Tdap to be updated. The Tdap vaccine usually is 10 years. You need to get a booster. So we will do that later. Next, I will ask you: do you receive any pneumonia vaccine?
No, I don't think so.
What about the shingles vaccine?
I don't think so. This name is so strange for me.
Okay. Do you have any children?
No.
What method do you use for the birth control?
Condom.
Okay. Next, I will ask you some questions about your previous medical history. Did you have any illness during your childhood?
No.
Did you have any trauma history? Had to go to the emergency room?
No.
Did you have any surgery?
No.
Have you ever been hospitalization?
No.
Okay. Have you ever been diagnosed as a sexual transmitted infection?
No.
Okay, that's great. Did you feel any sadness?
No.
Loneliness?
No.
Okay. Okay, Mike. Next, I will ask you some questions about your whole body system. overall, how do you feel for your health?
I think I'm in good condition.
Could you rate your health on a scale 0 to 10? 10 is the best.
I would say maybe 8. I'm not perfect.
Okay, that's good. Do you eat healthy?
I think so.
How many meals do you eat per day?
2 to 3.
Okay. How much water do you drink per day?
I did drink a lot, maybe 5 to 8 cups per day for water and coffee.
Okay, that's a good habit. Do you have any hair loss?
Hair loss a little bit, but I think it's just normal.
Do you notice any redness or lesions on your skin?
No.
Okay. Do you notice any color change on your nail?
No.
Okay. Do you have a mouth sore?
No.
Do you have any hearing loss?
No.
I see you are wearing glasses. When is your last eye exam?
Last year August, I take eye exam and upgrade my glasses.
Okay. So your glasses is fit for your wearing.
Yes.
Okay. Do you feel any pain in your breast?
No.
Did you notice any bumps in your breast?
No.
Did you notice any drainage or discharge in your breast?
No.
Okay. Do you feel difficulty breathing?
No.
Any chest tightness?
No.
Okay. At night when you sleep, do you use the same amount of pillow?
Pillows? Yes.
Okay. Do you feel a cold on your hand?
No.
What about the feet?
No.
Do you have any swelling anywhere in your leg, in your arm?
No.
Okay. Do you feel nausea and vomiting?
No.
Do you have diarrhea?
No.
Okay. Did you notice any color change when you of your urine?
Color change? No.
Okay. Do you feel pain when you pee?
No.
Do you notice when peeing more often or less often?
I didn't pay attention to that, but I don't think so.
Okay. Do you have a back pain?
No.
What about shoulder pain?
No.
Joints pain?
No.
Okay. Do you have any sleep problem?
No. I'm sleeping well.
Okay. Do you feel anxious?
No.
Do you feel confusion sometimes?
No.
Do you have headache?
No.
What about dizziness?
No.
Okay. Did you notice any bumps in your body?
No.
Did you have an unexplained weight loss?
No.
What about unexplained weight gain?
No.
Okay. Okay, Mike. Next, I will do the physical exam for you. Before I do the physical exam, I want to ask you a few questions. Could you tell me your name and date of birth again?
Okay. My name is Michael, and my date of birth is July 1st, 2001.
What's today's date?
Today's date is July 10th, 2021.
Do you know where you are?
Yes, we are in a hospital building.
Okay. Could you describe your mood for me?
I'm pretty good.
Okay. The patient is alert. He is oriented with people, place, and time. He is a 20-year-old male. He could communicate with me, and he is able to follow the command. Okay, Mike. Next, I will do the physical exam on your nose, mouth, throat, and neck a little bit, and also ear, since you complained the cough and sore throat. After that, I will do an exercise on your chest, lung, and heart. Okay? First, I will have a look at your nose. Could you please take off your glasses for me?
Sure.
Your nose is symmetrical. I didn't see any lines. Next, I will feel a little bit.
Mm-hmm.
Could you tell me if you feel any tenderness or pain? Any tenderness?
No.
Any pain?
No.
Okay. The nose has no tenderness, no pain, no masses, no nodules noted. Could you occlude one side of the nose and breathe with the other side? Any difficulty breathing?
No.
Could you change to the opposite side? Any difficulty in breathing?
No.
Okay, the nose is patent. Next, I will have a look at your nose. I will use my otoscope. Mike, I will use the otoscope to look the inside of your nose. I will let you know what I can see. Could you look up forward for me? I will place my hand on your head. Okay, the nasal is pink and moist. There is no foreign body, no occlusion, no aeration, no redness. The septum is intact. I will check the other side. The nasal is red and moist. There is no foreign body, no occlusion, no aeration, no redness. I also didn't see drainage on both sides. Okay, you can. Thank you so much. Next, I will check your sinus. First, I will feel here. This is your frontal sinus. Any tenderness?
No.
Then I will feel here. This is the maxillary sinus. Any tenderness?
No.
Okay. Next, I will use a light to shining on your maxillary sinus. Then I will check your mouth whether I can see the light. This is a pen light. It shines like this. Could you look up for me? Okay, open your mouth, please. Okay, I see the light through your upper plate. That means your sinus is clear. There is no occlusion. Then the other side. The other side, I could also see the light. The sinus is also clear. You can close your mouth. Thank you. Next, I will assess your mouth. First, I will look at your lip. Your lip is pink, moist. There is no dryness, no crackle, and no serum frontal sinus. Next, I will check the inside of your mouth. First, I will put on my gloves. I will use this pen light so that I can watch better. Could you open your mouth for me, please? Okay. The gum is pink and moist. The tongue is dull red color. I see there are about 32 white teeth, no caries or other applications. Could you lift up your tongue for me? I will check the underneath. Okay, the underneath is pink, it's intact. Okay, I will feel a little bit. Could you tell me if you feel tenderness? Any tenderness? Any pain? Okay. Now, could you lift your tongue up and down for me?
Like this?
Yeah. Then side to side. Okay. That means the cranial nerve 12, you can stop. Thank you. That means the coronal 12 is intact. Next, I will, could you please say ah? I see your uvula is moving in and upward, and the back of the throat is pink. The tonsillar is 1/4, which is normal. Okay, I will bring my tongue blade. I will use my tongue blade to poke the back of your throat.
A little bit uncomfortable.
Okay, the gag reflex is intact. That means the cranial nerve 9 is intact.
So it's normal reaction?
Yeah, it's okay. Normal reaction. Could you swallow? Yeah, and the cranial 10 is also intact because the patient could communicate with me without harness, and he is able to swallow. Next, we will access your ear. First, I will look at your ear. Your ear is equal for two sides. The pinna is in line with the outer campus. There is no obvious abnormal, no redness. Next, I feel a little bit. Could you tell me if you feel any tenderness, any pain?
No pain.
Okay. There is no masses, no nodules, no tenderness. Then I will look at the inside of your ear by using the otoscope. I will change this for you. First, I will check the right ear. I will pull the pinna up and back. The ear canal is clear. There is no foreign body, no chlorine, no cerumen, no redness, no aeration. I see the tympanic membrane. The membrane is intact. There is no irritation, no bulging, no rupture. It's curly gray color. The crown of light is in 7 o'clock. Okay, I will check the other side. I will pull the pinna up and back. The ear canal is clear. There is no foreign body, no cerumen, no aeration, no redness. I see the tympanic membrane. The membrane is intact. There is no irritation, no bulging, no rupture. The crown of light is at 5 o'clock. Next, I will have an access on your neck. Your neck is symmetrical. The skin is intact. There is no obvious redness and layering. And then I will feel a little bit. The trachea is in the middle, and the thyroid and the thyroid carriage aligned in the middle. There is no masses. Next, I will feel your lymph nodes. First, I will begin from the back. It's the occipital lymph nodes just under the skull. Then Any tenderness?
No.
Then I will move to the postal ear. It's postal auricular lymph nodes. Any tenderness?
No.
I will move to the front. It is the pre-auricular lymph nodes. Any tenderness?
No.
Then move to the end of the jawline and a little bit underneath. It's the tonsillar lymph nodes. Any tenderness?
No.
Okay, move ahead. It's the supraclavicular lymph nodes. Any tenderness?
No.
Then move ahead. It's submental lymph nodes. Any tenderness?
No.
Any pain?
No.
Okay. Then I will going down here. It's interior cervical lymph nodes. Any tenderness?
No.
Then going back. It's the posterior cervical lymph nodes. Any tenderness?
No.
Could you shrug your shoulder for me? Just a little bit. Okay. I'll check here. It's the supracervical lymph nodes. Any tenderness?
No.
Could you put your arm out for me? I will check here. Check here for the axillary lymph nodes. Any tenderness?
No.
Could you put your arm forward for me? I will check here. It's the epitrochlear lymph nodes. Any tenderness?
No.
The other side. Any pain?
No.
Okay. You can put your glasses on.
Mm-hmm.
Could you take off your shirts for me? Next, I will check your chest and lung and heart. I need you take your shirts off for me.
Okay.
Thank you so much.
You're welcome.
First, I will check the chest. The chest looks symmetrical. I didn't see any obvious difficult breathing. I did see here it's a channel chest. When did you first notice the channel chest here?
When I was 13 or 15 or 14, I noticed that.
Okay. Does it bother your breathing?
No.
Does it affect your daily life?
No.
Okay. The tunnel chest is a non-clinical significant. Next, I will palpate and feel the chest. You could let me know if you feel any tenderness or pain. Any
No.
tenderness?
No.
Any pain?
No.
Okay. There is no masses, no nodules, and no tenderness. Next, I will do the percussion. While I do the percussion, I will put your hand on your chest and use the other hand to kick off my finger.
Mm-hmm.
What I want you to do is to normal breath through your mouth. Okay?
Through my mouth?
Yes, through
Okay.
your mouth. Okay. Let's start it from the top. During the percussion, the resonance sound was heard anteriorly, bilaterally throughout the lung field. Could you please stand up and turn around so that we can see your back. Okay. We will also start from the top. While I do the percussion, I will try my best to avoid the scapula and the spine. On the back, resonance sound was heard through the whole lung area. Okay, you can turn around and have a seat. Thank you so much. Next, I will listen your lung sound. While I listen your lung sound, I would like you to do deep breaths through your mouth. I will start from the trachea area. In the second intercostal space. The fourth intercostal space. The sixth costal space. The sixth intercostal space. The sixth intercostal space and mid-cervical line point. The sixth intercostal space and the mid-axillary line. Okay, you can stop. Thank you. In the trachea area, I can hear the bronchial sound. The expiratory sound is greater than the inspiratory sound. In the second intercostal space, I can hear the bronchial vascular sound. The expiratory sound equal to the inspiratory sound. In the fourth and sixth intercostal space, I can hear the vestibular sound. The inspiratory sound is greater than the expiratory sound. Now, could you please stand up and turn around for me? Now I will listen the back. First, I will find the C7 bone. It's on the neck, the bone prominence. You could not miss it. Then, between the shoulder blade, it's the T3. Between C7 and T3 is the upper lung lobe. And below T3 is the lower lung lobe. I will start. Deep breath, please. stop. From the T3, from the C7 to T3, the upper lung lobe, I can hear the bronchiovesicular sound, and below T3, I can hear the vesicular lung sound. Then I will have a look at the anterior and the posterior chest to the transverse chest. It's about 1 to 2. It's normal. I just want to make sure the patient doesn't have the barrel chest. Okay, you can turn around and have a seat. The respiration rate is about 18 minutes. There is no whistle, no crackle, no abnormal lung sounds noted. Next, I will test your heart. First, I want to have a look at your chest, make sure there is no heart heaving, no lift, which it is. Then I will feel, since I have already prepared the chest, so this time I will only have a look at here, the fifth intercostal space and the middle cervical line. This is the apical pulse. The pulse is 2 plus. I will count the heart rate here. I will count 1 minute. Okay, the heart rate is about 72 per minute. Next, I will listen your heart sound. First, it's in the second intercostal space. The right sternal border is the aortic valve. I will use the diagram of my stethoscope. After this, I will use the bell of my stethoscope. The second intercostal space, the aortic valve. I hear S2 bigger than S1. Then the left side is pulmonamic valve. S2 bigger than S1. Then the third intercostal space is the Erb's point. S2 equals S1. The fourth intercostal space. This is the tricuspid valve. S2 smaller than S1. Then the fifth intercostal space and the middle cervical line, which is metrical valve. And the heart rate is about 72 per minute. Then next I will use the bell of my stethoscope to listen the same location so that I can listen the heart murmurs. The aortic valve, pulmonic valve, Erb's point, tricuspid valve, mitral valve, okay, I didn't hear any murmurs. There is no rubs, no ruptures, no murmurs, no rubs. and the heart rate is about 72 per minute. Now if our physical exam is over, you can put on your shirts.
Okay.
Thank you.
Mm-hmm. You're welcome.
Mike, I will conclude our physical exam. You don't have the lung infection. You also don't have the ear infection. I'm thinking your cough and sore throat is because of common cold. I will recommend you to have a good rest, drink plenty of water, and take some over-the-counter cough serum, for example, Tucin, and then plus the Mucinex, which you are currently taking.
Mm-hmm.
And thank you. This is the end of the video. Thank you.